is Brain Tumor Awareness Month, a time to educate the public, encourage research, and show support for the brain tumor community. And while both men and women are certainly affected, there are some gender differences. Albany Med neurosurgeon Dr. Alexandra Paul joins us now with more. Dr. Paul, great to see you again.
Good morning. Thank you for having me.
Of course. You and I were both at the Capital Region Brain Tumor Walk for a Cure just a few weeks ago.
Yes, we were. Did such a great job.
It was a wonderful event and so important to bring people together, and we'll talk a little bit about
Absolutely.
that. We know anybody who is faced with this diagnosis, it can be terrifying. I mean, there's more than 120 different types of brain tumors. So what is your best advice for someone who is newly diagnosed, other than obviously speaking with your doctor?
Yeah, so recently there's been this increase in community outreach and trying to form local support groups, which I think is really amazing because we spend such a short amount of time with the patients after their surgery, but to be able to talk to caregivers who are in similar positions or patients who have gone through similar things, I think is really such a benefit to the community.
Yeah. Right, you need each other. You need to know that you're not alone.
Absolutely.
There are some gender differences that we mentioned in our lead into this. And for women particularly, diagnosis is different. Talk to me about that.
Yeah, so there are some gender differences in tumor biology. So we know that meningiomas are more common in women. We think there's some relationship to estrogen. But outside of the different tumor types, what we do know is it takes women much longer to be diagnosed with a brain tumor. For some women, they have seen a physician 5 times and the diagnosis is still missing.
Wow.
Unfortunately, for many women, their symptoms are still downplayed. It's attributed to hormones or to being tired or anxiety. And so this is common not just for brain tumors, but really across the medical spectrum.
It is. It's, you know, we have to be the advocates then. It's even more important. If we feel something's wrong, we've really got to speak up and demand that it be taken further, right?
Absolutely. You know your body better than anyone. And if you feel that something's off, then don't let yourself be dismissed.
So we know that there are certainly malignancies, and they're the most serious types. There are benign types of tumors as well. There's still so much more research that needs to be done, though, right? I mean, despite the work that's been done so far, we're still a long way from a cure.
Yeah, the standard treatment that we're using for high-grade glioma is the same treatment that we've been using for 20 years.
Wow.
And so it's really important to all of us that we continue to develop funding and research and clinical trials to advance the treatments we're doing and hopefully one day come up with a cure.
We get to that place. Treatments certainly can vary for people, but obviously there are different options available. Just, I mean, it's not always chemo for some people, right? Sometimes it's just radiation. Talk to us a little bit about that.
Sure, so a lot of that depends on the tumor type.
Yeah.
And like you said, there's over 100 types of tumors that can happen in the brain. And so there's not one size fits all prescription for treatment. But for many patients, surgery alone can be curative. So for many types of meningiomas or pituitary tumors, or even grade 1 gliomas, those patients only need surgery.
Yeah.
For some of the more aggressive tumors, those patients typically do need chemotherapy and then some post-operative radiation.
Now, we know it's hard not to panic when you get a diagnosis like this, but really, there are those types where there's reason to be very hopeful.
Absolutely.
Yeah, like you said with meningiomas. Thank you so much for coming in to talk about this. And I know we've got a long way to go, but that's why the research is critical. That's why we keep having those events to make sure we spread the word. Great to have you here. Please
Thank you
come back and see us, of course. And remember that you can find all of our resources and our Women's Health Wednesday segments online. Go to news10.com. Look for Women's Health under the Community tab. We'll be right back.
You're watching News 10 AB.